Hello, everyone, and welcome to Connecting the Dots with Dr. Ashaye. So unfortunately, so much of healthcare is rushed so that there isn't time to address foundational health behaviors. And so people are quickly started on medicines, and the number of medicines keep increasing, but sometimes the conditions keep getting worse. And today, I want to continue the series we started last week. I'm going to be sharing 3 more key foundational behaviors that anyone at any stage of their health journey can start doing today. And a lot of these things, like I said before, you've probably heard, but the proof of knowing is in doing. So there's always room for improvement. So I hope you listen with an open mind. So this is Connecting with the Dots with Dr. Ashaye. I'm your host, Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of In Touch Primary Care in Sugar Land, Texas. And what we offer is concierge care with direct access to the doctor. Our patients can get the care when they need it without all the inconveniences and delay in the regular healthcare system. You can learn more about our services at intouchprimarycare.com. And if you're in the Houston area, you can actually schedule a free 15-minute consultation to learn more about our services, and you can do that on our website. If you have not already, hit that subscribe button. That helps us get the word out so more people can get this information. And as always, check with your own doctor. Okay, so let's get into it. Foundational health behaviors. So current literature suggests that anxiety and depression can be an independent risk factor for heart events, for cardiac disease. And we know that depression tends to go well or go with people that have heart disease, have usually depression is associated. They often have depression as well. Also with diabetes, and that there is a 50% increased risk of cardiac events in people with depression. Depression has also been shown to be an independent risk predictor for coronary heart disease. And the mechanism of action for that is what we think is thought to be related to the sympathetic response, which can increase inflammation. So our emotional well-being actually affects a lot. And last week we talked about stress and how, it's important to lower stress levels, because one of the things that triggers depression is a stressful event, or chronic stress can be a trigger for depression. So our emotional health well-being is really important. Another overlooked aspect of healthcare that is foundational, and this is the first one I'll be talking about today, is social connections. And so when we look at all of positive psychology interventions, meaningful social connection has been the one to have the most powerful effect. Positive interactions with others are actually powerful boosters to our parasympathetic nervous system, which helps to lower stress. So as a result, when we form and maintain meaningful, helpful relationships, is actually scientifically shown to result in better health outcomes. So studies have shown that people dealing with life-threatening health conditions, if they have healthy relationships, they tend to do better than those that don't have healthy social connections. So being friendly actually helps your health. So it's important to, don't isolate yourself, build healthy relationships, don't take people for granted, because actually being around people and forming healthy relationships impacts your health positively. So that's the first thing, healthy social connections. The second thing is something that some may apply to some people, maybe not everyone, but avoiding risky substances. So in terms of alcohol, 1 drink or less per day for women has been shown to be the amount tolerated. 2 drinks or less per day for men. And then if you do not drink, it's actually not advised to start drinking. In the past, there was a lot about red wine being good for the heart. However, more research shows that moderate amounts of alcohol actually doesn't have benefits. So if you're not drinking now, the recommendation is don't drink alcohol because you're trying to, help the heart. Okay. So alcohol, that's with alcohol, moderate amounts, but if you do drink, but if you don't drink, don't start drinking. In terms of smoking, which by now most people have heard that tobacco is very harmful. It's the number one cause of preventative death in the US and worldwide. And for everyone who dies from smoking, there are at least 30 people who are living with serious smoking related illnesses. So even if people don't, die from like lung cancer or other conditions that affect, that are caused by smoking, they tend to have serious health conditions associated with it. More than 1 out of 3 cancer deaths are from smoking. And even though people smoke less today compared to 50 years ago, people that smoke are at higher risk of developing lung cancer because of how they've changed the design and the composition of tobacco. So 70% of the chemicals in cigarettes are carcinogenic. So if, smoking is a bad idea all around. And this is even for people that do smokeless tobacco. So if they're chewing, snuffing, using dissolvable products, that hasn't been shown. There isn't any clear evidence that this is a safer alternative. So in general, the advice is to avoid tobacco. So that's the second thing, avoiding risky substances. The last thing in terms of a healthy foundation is regular checkups. And I say this because despite our best efforts, there's still many things about health, about our bodies that we don't know. So, or we don't understand. And one thing is clear though, that how you feel is not the best indicator for what your health is. So there are a lot of people that have high blood pressure, they've never checked, they feel great right now, but their heart is being affected, their kidneys are being affected, and they're not going to find out until much later when they start to have symptoms. And by then, it's pretty late. So don't wait until you feel something to get checked out, because how you feel is not the best indicator for what's really going on in your body. It's so important to have regular checkups. Most people will need to see a doctor once a year, and some people will need to see a doctor more frequently than that, but most adults should be seeing a doctor once a year. Kids usually have scheduled, yearly or even, month, depending on their age, they may need to see a doctor more often. But don't take that for granted. The regular checkups are so important because, again, how you feel doesn't always translate to what's really happening in your body. So the good news, though, is when things are found early, it can be many of the things that cause problems can be easily reversed when they're found early on. So a regular checkup is, is so worth it. Okay, so many of these behaviors are simple. They're simple to incorporate in our daily lives, and they can make a huge difference to our health. They can also be started by most people, regardless of where you are in your health journey. So don't delay your health care. You can start today. You can start with one thing. And so in summary, there are 7 things that are recommended to build a solid health foundation. And you can look at the first video to learn more about these all the other ones. But number 1, eat more plants and whole foods. Number 2, be physically active. Number 3, prioritize sleep. Number 4, intentionally manage stress. Number 5, healthy social connections. Number 6, avoid risky substances. And number 7, regular checkups. So if you're in the Houston area and you're looking for a doctor that is proactive about your care, well, we're here at In Touch Primary Care. You can learn more about our services at www.intouchprimarycare.com, or you can call us, or you can schedule a free 15-minute consult. We look forward to helping you on your journey to better health. So just imagine that you started doing one of these things. Let's say you started seeing your doctor regularly, or let's say you started paying attention to your stress level, or let's say you started being intentional about forming relationships. The thing about this is it helps so much in reducing your risk for health conditions, And even if you still need to take medicines, oftentimes the medications that you end up taking will be at lower doses or less frequently or less medicines in general. So there are many benefits of making lifestyle behaviors for your health. So if you know anyone that will benefit from this, please share this episode with them. And until then, we will talk to you again next week at 2 p.m.